So what I want to turn to now is an overview of the drug development process. Now, this is going to be a bit of a cartoon caricature. The details you will hear about in the second part. I'm going to try to give you just a very broad overview and then talk a bit about the analytics. I want to begin with the home page of the FDA, because they are the ultimate gatekeeper in terms of determining whether drugs are going to be safe and effective. And if you look on the home page, you get a very interesting picture. So this is the picture. It's not a picture of drugs and their profits and losses, or the probabilities of success or failure, or the molecular compounds that they've analyzed. It starts with the patient. And this is really important because all the things that we discuss, particularly in a class like this, tend to be focused on business aspects. That's obviously what we're doing here in a business school. But drug development is ultimately about patients, and it's very important not to lose sight of that, because as soon as you do, you can actually start getting into trouble for reasons that we'll see a little bit later on. So I want to point this out now because I want all of you to start thinking about clinical trials as something that one of your family members is going through. And if you do that, you're actually going to think about this very differently. I want you to ask questions in your own mind, if not aloud, as to why certain rules are the way they are. Why does it take so long? Why does it cost so much money to do these trials? Why do we have to control these experiments in a very particular way? And when you start asking these questions from the perspective of one of your family members is going through a clinical trial, it actually becomes a lot clearer. And that's part of the business aspects as well, because obviously costs are something you have to factor in. And I want to illustrate to you where those costs are coming from. They're not there just to pad the fat expense accounts of drug marketing representatives. That is an industry kind of a myth that once you understand some of the economics, it becomes a lot clearer where the money is going.